Thank you for having me. Thank you so much, Ife, for organizing this. It's always a pleasure to share whatever we know to help as many people as we can. So today I'll be talking about the coronavirus, testing, mostly focusing on testing and vaccination. So I will start here with a disclaimer that the information that I will present to you today is based on the current research and guidelines that we know so far in the science community, and things are constantly changing. So it's very likely, it's very possible that 2 months from now, 6 months from now, new findings will come up, new research will be done, and new guidelines will come up. And don't feel like we lied to you, because we do what we can with the information we have at hand, and we're constantly researching, constantly trying to figure out this pandemic that, I mean, from the start no one really knew anything about it. You know, we made recommendations at first. When it started, they said don't wear masks, and then a few months later they say wear masks. So we just kind of make decisions as we find out more information. Don't feel alarmed when things change. It's kind of expected with this virus. So, what is the coronavirus? It's actually very similar to the influenza that Dr. Nike just talked about. It's actually in a similar group, and it's also a respiratory virus. It causes, it's transmitted by droplets, by airborne, and also we speculate that it can also be transmitted by contact. So when you touch someone who was infected, you can also become infected. And the way that this virus primarily affects us is that it causes an inflammation in the body. So it causes a systemic inflammation that mostly affects the lungs. But when the infection is severe, it subsequently affects your kidneys, it affects the liver, and eventually it affects the brain and the entire body, and causes the entire body to shut down. So, but it usually primarily affects the lungs, and in mild cases, it would present as a common cold or as a flu influenza infection. And so, as we know, this virus started in, I mean, as far as here in the USA, mostly in March, April was when we had a sharp peak in the pandemic. And as we can see here, the trend recently, we started having increasing peak in the number of daily cases, and also in the number of daily deaths. So as of December now, we're almost at the level that we were in March and April in terms of the number of people infected. However, I would point out that even though we're getting more patients infected this time, we're not getting as many deaths in the hospitals, in our ICUs as of yet anyway, compared to where we were back in March and April. And that is probably most likely due to the fact that we have come to understand the virus a bit better, and we have come up with some therapeutics, some treatments that are probably better than what we had in March and April. And also there's probably a component of immunity. Patients who have had the infection tend to not have it again, although there are few that have been infected twice. And also just based on the fact that there's probably some sort of herd immunity as well. But it's still a problem, and it's still something that the medical community is really, we're almost like at war with this virus, trying to figure out what to do and how to help the patients. So it's a challenge. So what are the common symptoms that people experience with this virus? Very common, similar to the flu. You have fevers, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, headaches, loss of taste and smell. That's a very peculiar one that some people are having. For some people, that's the only symptom that they present with. They just lose their taste and smell. Some patients have sore throat, congestion, runny nose, some nausea, vomiting, diarrhea. And so these are some of the most common symptoms that you would see. There are other types of symptoms that people are presented with. Some patients have just fainted at home and then they're brought to the hospital and found to have the virus. But these are the most common symptoms that you would see. Now, these symptoms seem mild. They're not as alarming as some other symptoms that a person could present with. And these are more alarming symptoms that if you have or if a person has, they should try to get their way to the emergency room. So if you feel like you can't catch your breath, you feel like you have persistent chest pain, chest pressure, or there's altered mental status, a person is confused, they don't know where they are, they can't remember their name, or they can't be fully awake, they feel drowsy, sleepy, you can't wake them, you can't fully arouse them, then those are signs that the person has suffered a loss of oxygen, loss of oxygenation in their blood and in their organs, and so their organs are starting to fail. So by the time that someone feels this way, they have to emergently go to the emergency room. Or if there's any change in color of the face of the skin. Um, Talking about testing, when to get tested, right? So we actually recommend testing early rather than later. So if you find yourself having any of the symptoms that I talked about, the cold, the cough, the fever, runny nose, sore throat, it could be a few years back, if anyone had those symptoms, you would think you have the cold or the flu, like Dr. Nike just talked about. But now it's hard to tell. You can't tell specifically, but to be on the safe side, it's best to get tested. That way, you know for sure if you're infected and you can quarantine, especially if you live with family or you come in contact with a lot of other people. It's important. I know it's scary to get tested, but it's better to get tested so that you can quarantine, take better care of yourself, rest, eat better and recover than ignore it and just go about your day and hope that everything is fine. So we strongly encourage early testing. And after testing, you should self quarantine until you get the results back before you can go out there. And if you do test positive, you can, depending on what symptoms you have, you can usually just wait it out, try to rest, self quarantine, and just monitor yourself and see how you're responding. And if you're progressing towards the more alarming symptoms, then you should go to the emergency room. In either case, you should let your primary care doctor know if you test positive so that you can keep a constant communication with them. Sometimes we've had patients not come into the office, but call us on the phone and describe their symptoms, tell us what they're experiencing. Because once you have the symptoms, it's very hard to be objective to know what's going on. Your nose could be itchy and you think it's related to the virus, right? So it's important to stay in touch with your healthcare provider to let them know what's going on so we can advise you, okay, now you need to go to the emergency room, or okay, you can stay at home longer and try to recover. So very important to test early and to address the symptoms as they present. Um, Now, I skipped over the specific treatments because, again, treatments have been changing a lot, and most of the treatments these days are administered in the hospital. So for patients who get admitted, who have severe enough symptoms to get admitted, and different doctors would treat slightly differently based on the evidence that they look at. So I'm not going to go over those specific treatments. So let's talk about the vaccination, right? So here in the USA, the vaccine that was approved by the FDA and the CDC is the Pfizer BioNTech vaccine. And actually, in my hospital, they started vaccinating medical staff on Monday. And they claim that this vaccination has a 95% efficacy in preventing COVID-19 infection. Um, And again, we should remember that the process of testing and approving this vaccination was a very quick and emergent process. Usually, the process of developing a vaccine to the point of approving and distributing to the community takes several years, all right? Because you have to start by, testing it on animals, testing it on rats, and then going up and testing it on higher animals, and then going up testing it on, a select group of people. So it takes a long time. But because of the nature of this pandemic, they had to rush, I would say, rush to quickly come up with this vaccine. So there's a lot of uncertainty, there's a lot of fear, and there's a lot of mistrust that comes with it, and understandably. So we can only hope and do the best we can and go, because we have to do something, right? And so this vaccine is a two-part injection. So you take the first vaccination, and then 17 to 21 days later you take the second part. And ideally, immunity is, I guess, complete or better after you get the second vaccination. And if for some reason you took the first vaccination and it was more than 21 days, let's say your schedule didn't allow you to be able to take the second vaccine on the 21st, by the 21st day, you can still get that second vaccine. You don't have to retake, the first dose before you take the second dose. However, it's best to take it within that window if you can make it. So what are the side effects of this vaccine? This is a very common worry that most people have. What's the long-term effect? What is the short-term effect? So the immediate effect, side effects of the vaccine are, fevers, chills, muscle aches, some headaches, pain at the injection site. Again, the vaccine helps your body to build its immune system, right? To build up an attack mechanism for the virus, and so that's why you would experience this muscle aches, the fevers, the chills, because your body is reacting quickly to mount a defense against a potential virus should you get infected. So that's why you get those side effects. As far as long-term effects, there's a lot of conspiracies out there about what's going to happen next year. My husband jokes that, because he's very skeptical about it, he says, he doesn't want to get this and then turn into a turtle or something else. But there's a lot of speculations, and people, they have reason to fear, but as far as we know, we don't know what the long-term side effects of the vaccine might be in the future. And that's just something we have to use our judgment, our gut feeling, in talking to our physicians, and getting all the information that we can, like we're doing today, learning more about it so we can make better judgment for ourselves. So then with this immediate side effects, it's okay to take Tylenol or ibuprofen after the vaccine to help with the pain. And it's recommended to continue wearing masks and continue washing hands until we get to a point where this virus is under control, or there's some sort of herd immunity. So after your vaccine, you can't just go about without your mask or without washing hands, because we don't know, there's still a small risk of getting infected. And so at this point, the vaccine is not mandated in any establishment that I know. Even in my hospital, if you're not comfortable taking it, you're not being forced to take it. So mostly because of the nature of how the vaccine was made very quickly, and there's a lot of fear. So it's up to you and I to see all the information that's being presented and make a judgment on whether or not we want to take the vaccine. So as of right now, the people getting the vaccine right now, especially here in New York, are the frontline workers. So the healthcare workers, the doctors, the nurses, and the hospital staff, because we face, we see patients with the virus on a daily basis. Like overnight, I worked overnight, and that's why you still see me in scrubs. We had a lot of, patients coming in testing positive with COVID, and constantly in contact. So So they prioritize us to get the vaccine. And after that, they'll move on to nursing home residents, people who are more susceptible to get infection. And then I think every state has a different policy from there as to who gets it next. And there's a website. If you go to the New York Times and you search "find your place in the vaccine line," you would be, and you put in some demographic information, your age, like few, not personal information, just general demographics and your location. They can kind of estimate when the vaccine might get to you, because since it's just the first week of the vaccine being released, it's very limited. There's very limited supply. Even in my hospital, we aren't, not every resident or doctor has been able to get it yet. So they started with, you know, doctors working in the emergency room, because they are like the front lines, and then doctors working in the ICU, where many of the patients are, you know, kept in the hospital. So that's kind of how they're stratifying and strategizing the distribution. And so, so patients who have also previously gotten infected are also recommended to get the vaccine. They're not excluded from getting the vaccination, because again, there's a chance of getting reinfected even after the first infection. So, now, who should not get the vaccine? Currently, the CDC is recommending that people who currently have the infection should not get the vaccine, because they think that it might not be as effective. So if a person currently has the infection, they have to wait at least 14 days from symptom onset before they get the vaccine. And then if someone has also previously been treated, recently treated with the monoclonal antibody or the convalescent plasma therapy, these are some of the treatments that are being used. They have to wait at least 90 days before they go for get the vaccination. Also, they recommend that if you recently got your influenza vaccine or other vaccinations like hepatitis, any other vaccinations, you should also wait at least 14 days before you get the COVID-19 vaccine, so that there's no sort of interaction. So let's talk about special populations, like pregnant women. Are they allowed to get the vaccine? So on this subject, there's no clear data to support whether or not they should get the vaccine. So it's just based on clinical judgment. So if someone's pregnant, they would have to talk with their OBGYN and see what's best for them and see what other risk factors they may have. But currently, they're not excluding any pregnant person from getting the vaccine. So if a pregnant person they're willing to get the vaccine, they will be given the vaccine. But it's very there's very divided opinions about this. I have some colleagues who are pregnant who are saying they're not getting the vaccine, and some other ones who are going for the vaccine. Because again, in the hospitals, we've seen a lot of third trimester complications in women who got the coronavirus. So it's a scary time, for this population, and especially not knowing what the answer is, kind of having to figure it out as you go. So really, we just have to hope that we get more information as we go forward. In the initial research study that was done before the vaccine was approved, a few of the participants apparently were pregnant at some point. So they're still trying to come up with a meaningful, reasonable data that would tell us more clearly whether or not pregnant women should get vaccination. Now, what about people who have other medical conditions that make them to be immunocompromised, like HIV or cancer, or any person taking any sort of immunosuppressive therapies like steroids or chemotherapy? So again, here, there's no real data. We don't know for sure how this virus will affect them, but since this virus is not a live virus, like Dr. Nike was saying, a live virus is a virus vaccine. It's a vaccine where they take the actual virus and they sort of, I would say, disable it from being an active virus and then inject it into you, and that helps trigger the immune response. But in this case, this virus is not an active, it's not a live virus. I mean, this vaccine is not a live virus, so we think that it's less likely that it will cause any problems for patients who are immunosuppressed. Um, Talking about the efficacy of the vaccine, again, the Pfizer company is predicting that it has a 95% efficacy, and we are, relying on that and going forward to vaccinate and hoping that we're doing the right thing. And we think we're doing the right thing, and just kind of doing more research to figure out, to learn more about it and see if we can make any changes. So that's that for my talk. If anybody has any questions, I guess I can take them whenever, I guess at the end of the talk.